Do you ever feel like there's a strange, soft lump on the side of your child's neck that wasn't there before? Or maybe your baby seems to have breathing or swallowing issues. If yes, it might be worth checking for a condition called cystic hygroma, also known as cystic lymphangioma. This is not cancer, but a growth that forms when tiny tubes in the body, called lymph vessels, don't develop right before birth. These vessels usually carry fluid that helps fight infection, but when they get blocked or form wrong, they can swell up like a tiny water balloon under the skin. It's most often seen in babies or kids, especially in the neck or armpit. Think of it like a traffic jam in your body's drain system, but instead of water overflowing in a sink, a soft pouch forms under the skin. So what causes cystic hygroma? Imagine building a house, but the plumber makes a mistake and forgets to connect some pipes. That's kind of what happens in the womb. During early pregnancy, the lymphatic system, which is like a cleanup crew for body fluids, doesn't form properly. This leads to pockets where fluid gets trapped. Most often this happens between weeks 9 and 16 of pregnancy. Sometimes it's linked to genetic conditions like Down syndrome or Turner syndrome. For example, if a baby has extra or missing chromosomes, the body's blueprint gets mixed up, and systems like the lymph vessels can form abnormally. It's not caused by anything the mother did wrong, just a random typo in development. There's no blame, just biology doing its imperfect dance. Now, what does it actually look and feel like? Let's play detective. You notice a soft, squishy lump on your child's neck, under the jaw, or even in the armpit. It might be small at first, but grow over time, especially if your child has a cold or infection. Sometimes it can press on the windpipe or food pipe, making your child cough, whistle when breathing, or struggle to swallow. Imagine blowing up a balloon inside a tight box. The more it grows, the more it presses on everything around. In some cases, the skin over the lump might look bluish or feel warm. But guess what? Often it doesn't hurt at all. That's why it can go unnoticed for weeks. Parents usually spot it during bath time or while hugging their child. That's why being hands-on and observant helps catch things early. How do doctors know it's cystic hygroma and not something else? Great question. First, they'll ask, when did you first notice it? Did it change size? Then they'll gently touch the lump because it feels soft and movable. That gives clues. But the real magic is in imaging. Think of an ultrasound like a baby camera that uses sound waves to see under the skin. It shows if the lump is filled with fluid, like jelly in a donut. For deeper look, doctors might use an MRI, which is like taking super detailed photos of body layers. Once confirmed, treatment depends on size and location. Small ones that don't bother the child might just be watched. Bigger ones, they might need surgery to remove the lump safely. Another cool option, sclerotherapy. That's when doctors inject a special medicine into the lump, like squirting glue into a water balloon to make it shrink. Most kids do really well after treatment, back to laughing, eating, and playing without trouble. Can we stop cystic hygroma before it starts? Right now, we can't fully prevent it because it happens so early in pregnancy and often by chance. But here's the hope: regular prenatal checkups can help. Imagine an ultrasound during pregnancy, spotting something unusual like a bigger neck pocket in the baby. That's a red flag doctors can catch early. If there's family history of genetic disorders, genetic counseling can help parents understand risks like checking DNA before or during pregnancy. Eating healthy, avoiding alcohol and smoking during pregnancy also helps the baby grow safely. While we can't control every twist in development, love, care, and early checkups go a long way. Prevention isn't about perfection, it's about giving every child the best possible start. What's new in science? Exciting stuff. Researchers are learning how to target lymph vessel growth more precisely. For example, some new studies are testing drugs that block signals telling the vessels to grow too much, kind of like putting a stop sign on bad plumbing work. There's also progress in using tiny particles called nanoparticles to deliver treatment straight into the lump, reducing side effects. Another big step, fetal surgery. In rare, severe cases, doctors are trying to fix the problem before the baby is born. Also, gene research is helping us understand why lymph systems fail, which could lead to earlier detection or even prevention in the future. Imagine a world where a simple blood test from mom's arm could predict and help manage this condition long before birth. We're not there yet, but science is moving fast and giving hope to families every day.